Okay, so getting to look at another complications of what? Typhoid. We said that typhoid, if it is left like that without proper treatment, it can actually what result to some crazy complications. So one of these complications, we are saying that there will be what? Intestinal perforations. All right, there will be intestinal perforations. So this intestinal perforation can be caused by typhoid. So we're trying to look at the sites of intestinal perforation, causes of the perforation, symptoms and complications of the perforation. Of course, if there's perforation, there will be leakage of abdominal contents into the abdominal wall. That's the peritoneal cavity. It will lead to inflammation. That's what peritonitis. You get. So if you look at this video, there's no pictures. Why? Because I made this video, I posted it on YouTube with all the intestinal perforation, and they flagged the video down for what? Shocking content. Because any content that is showing blood, wound, and all of that is shocking content, so they don't need those videos on YouTube. I tried to explain that it's for educational purpose, but they said that the rule covers everybody. So that's why I'm making the video without a picture. So if you want to see pictures that are attached to this video, simply just comment on this YouTube channel and I'll bring it to you. So perforation can be caused by typhoid fever, and they actually were the serious complication of the disease condition. So they occur in 2 to 10% of all typhoid fever cases. Typically, it will occur in the 3rd or 4th week of the illness. Okay. So now, what are the most common sites of these perforations? You can have the terminal ileum. In about 70 to 80% of the perforations occurs in the terminal ileum. Then the cecum. About 10 to 20% of perforations will occur in the cecum. Then the jejunum. About 5 to 10% of what perforation cases will occur in the jejunum. Okay. So what are the causes of this perforation? It could be due to ulceration of the intestinal wall due to what the Salmonella Typhi infection. There could be due to necrosis of the intestinal tissue. Could be due to what? Hemorrhage, that's bleeding in the intestinal wall. Okay. So what will be the symptoms? A patient that has perforation already, how will they present to you in the clinic? So there will be severe abdominal pain. Okay. There will be tenderness and guarding in the site of perforation. Okay. So there will be rebound tenderness, there's fever, there's chills, there's vomiting, there's abdominal distension. Okay. This will be the primary problems of a patient that has what? These perforations. What are the complications? Just like I was explaining, abdominal contents could actually come out, stay in the abdominal wall, leading to what? Peritonitis. Okay. Then there could lead to what? Abscess formation, intestinal obstruction, sepsis, shock. Okay. Treatment would basically be what? Immediate surgical intervention, resection of the perforated segment, repair of the perforation. Okay. Then you can also give antibiotics just to tackle, there will be some abdominal bacteria that will be on the loose too. So you want to handle these guys, right? The supportive care just to manage things like shock or sepsis might also be helpful. So that's it. What? Intestinal perforation caused by typhoid fever.